Hello. This is a lecture and a teaching demonstration about the anatomy of the heart, and the human heart to be more specific. My name is Dr. Peter Mitchell. So there's one main objective I want us to focus on throughout this lecture, and it's to know the important anatomical structures within the human heart. Some sub goals that we can focus on to make it a little bit more tangible is the first is I want to define what the atria and ventricles are, as well as their function, describe the electrical system within the heart, list the names of the valves in the heart, their location and function, and lastly, describe the specific direction of blood flow within the heart. So if we really zoom out and look at the heart from a 1,000-foot view and think of it from a more general, simple approach, the heart is a four-chambered organ comprised mostly of cardiac muscle tissue, which is different from skeletal muscle tissue or smooth muscle tissue, that undergoes specific rhythmic contractions to pump blood throughout the body. If we just make that statement a little bit less formal, we can say that the heart is a muscle comprised of very specific type of muscle tissues that is a pump, and its job is to pump blood all throughout the body, and it does so really effectively. So a couple of things I think that are really important to point out just to show how special the heart is and how amazing it is. The first is that your average human being's heart rate falls from between 60 beats per minute and 100 beats per minute. So if we assume we take a person whose heart will beat 75 times a minute on average throughout an entire day, that equals 108,000 contractions in a single day. So to put that into context, imagine that you have a magical sponge that every time you squeeze it, all the water will come out. As soon as you let go, it refills with water. Imagine having to squeeze that magic sponge 108,000 times in one day. For a couple of squeezes, it's not bad, but you repeat it, 100,000 times. That's exactly what your heart is doing every single day and throughout your entire life. Now, let's take that same heart, and if we assume that it fills with 70 milliliters of blood, which is not an unreasonable amount, I would say on average, the amount of blood that the left ventricle, when it contracts, will squeeze out. 70 milliliters is pumped in each contraction. If we do the same calculations, that comes out to 14,000 liters of blood in one day, which is the same volume of liquid that fills your typical backyard pool. So think about that. The same volume of water that's in a backyard pool is pumped through your heart every single day. Pretty darn amazing. So next time you have an opportunity, make sure you say thank you to your heart. Okay, so let's talk about the four different chambers in the heart. So there are four different chambers. They're broken up in two different ways. One, we can think of it as above and below. So above we have the atria, and below we have the ventricles. It's also important to differentiate the right side of the heart and the left side of the heart. The right side of the heart is oxygen poor, so it's blood returning from the body that oxygen has been used up. The left side of the heart is oxygen rich, so it's blood that's coming back from the lungs and is getting ready to be pumped out to the rest of the body. So on the top we have the right atrium, and on the left we have the left atrium, and then on the bottom right we have the right ventricle. Bottom left is the left ventricle. The atria, to be more specific, their job is when the heart contracts, the atria, that chamber will contract to aid in filling the ventricle as much as possible. So gravity will aid in filling the ventricles because it naturally will pull blood downwards, but the contraction gets the last little portions of blood that are in the atria down into the ventricle, so the ventricle can send it to where it goes. The right atrium fills the left ventricle, the right atrium fills the right ventricle, the left atrium fills the left ventricle. If we compare the muscular walls thickness of the atrium and the ventricles, it would make sense that the walls would be thinner because it doesn't take as much muscle tissue to create a contraction because the demand is much lower for the atrium than the ventricle. So those ventricles, with their really thick muscular walls, their job when they contract is to send blood away from the heart. So their walls are significantly thicker to compensate for how much extra force it takes for them to overcome the amount of pressure that is the amount of resistance that's provided by the rest of the body when the heart is contracting, whether it's going to the lungs or to the rest of the body. So the right ventricle, when it contracts, it sends blood to the lungs. When the left ventricle contracts, it sends blood out and away to the body. So the left ventricle is significantly thicker and it has higher volume than the right ventricle because the left ventricle has to send blood throughout the entire body, not just to the lungs. So we're going to take a step away from lecture, and I want you to think about this question. Is having a large heart a good thing or a bad thing? So pause the video, take 1 minute, think about it, write it down. Doesn't matter if you're right or wrong, okay? Take a break. Okay, welcome back. So it's a little bit of a trick question because having a large heart can be a good thing, but it can also be a bad thing. Depends on the demands that are placed on that heart. What are those demands and how can they be different? If we take an aerobically trained individual, somebody who is regularly running at a low intensity for a long duration, multiple days a week, and do that for a couple of years, their heart will undergo significant adaptations so that the left ventricle volume will increase, ultimately raising to a bigger heart. They will also have thicker ventricle walls on that left side. So their heart is stronger and can accept more blood per contraction to increase their cardiac output, ultimately make them a better athlete. So if we take an individual who is sedentary, who does not move very much throughout the day, that individual's heart will change, but their blood pressure is a lot higher because they're not exposing themselves to regular exercise, and so that blood pressure is harder on the heart for it to overcome, and that constant stimulus will actually thicken the left ventricle walls, but the volume of the inside of the ventricle will actually shrink over time, and so it doesn't accept as much blood. So if you're sedentary, having a large heart is not a good thing, but if you're very active, having a large heart is a good thing. It's just the change in size is different in those two scenarios. Okay, let's move on and talk about the electrical conduction system in the heart. So it starts out, the initial contraction of the heart is controlled by the sinoatrial node. So it's the first point of electricity that's created, and it's sent down systematically through the heart through different structures. Its typical rate of contraction will occur from 60 to 100 beats per minute. So it will create electricity 60 to 100 times per minute to get the heart going. The next structure that follows just down, and these structures are connected, is the atrioventricular node. So it creates a little pause in the electricity coming from the sinoatrial node to allow the ventricles to have an opportunity to be filled optimally before they contract. So that helps that sort of systematic contraction that we talked about earlier. It allows that to be more efficient. So after the AV node, we have the bundle of His, which then branches into the bundle branches. So that now becomes right and left. Those branches will make their way down the interventricular septum and ultimately branch even further into the Purkinje fibers, which come out and surround the ventricles. Okay, we get to take another pause in the lecture. I want you to take another pause, go for a minute, and think about this question. Why do you think that the locations of specific cardiac conductive structures matters? Let's go ahead and pause the video, take a minute, think about it, and we'll reconvene in a moment. Okay, so the correct answer is that we come back to that systematic contraction, right? So the atria have to contract first to fill the ventricles. The ventricles, if they just contracted at the same time, there would not be an optimal amount of blood in them so that when they contract, they get as much blood out into either the lungs or the rest of the body. So it starts with the atria. While the atria relax, then the ventricles will contract. While the ventricles are relaxing, the atria will then ultimately contract. So it's this systematic top to bottom system. So when you listen to a heartbeat, that lub-dub is the change in that represents the systematic contraction of the different chambers. Okay, blood vessels. So what good is a pump without any tubing for it to send its fluid into multiple directions? And so we have a handful of important large vessels that will do that, right? They bring blood back into the heart, and then they aid in getting blood out of the heart. So we have the inferior and superior vena cava. So those vessels will lead into the right atrium with oxygen poor blood that's returning from the body. The next important structure is the pulmonary arteries, which actually branch from the pulmonary trunk. But those pulmonary arteries are also oxygen poor blood. So this is the perfect opportunity to talk about how everybody is taught that arteries are oxygen rich and veins are oxygen poor. But that is an incorrect statement. Arteries always leave the heart and veins return blood to the heart. So, and this is the example of the pulmonary arteries and veins where the typical rule is reversed. So anyway, pulmonary arteries lead away from the heart going towards the lungs. You can think of it arteries away in the pulmonary arteries and veins. So then pulmonary veins bring oxygen-rich blood back into the left atrium, which then gets down, the blood is into the left ventricle and is pumped through the aorta to go out to the rest of the body with oxygen-rich blood. So the valves are extremely important. So without the valves, we don't have one direction of blood flow throughout the heart. Without the valves, when a contraction occurs, we have backwards movement, which is obviously not productive to getting blood throughout the body. So we have our atrioventricular valves, which live, it's pretty easy in this one, between the atrium and the ventricle. And so we have one on the right side and we have one on the left side. The right atrioventricular valve is called the tricuspid valve, and the left atrioventricular valve is called the bicuspid valve, but it is also called the mitral valve or mitral valve. So a good, easy moniker to use to remember which one is which. You always try before you buy. So if we follow the typical blood flow through the heart, tricuspid comes before bicuspid. Try before you buy. Before Amazon came along, we used to go to these things called clothing stores. And you would go into the clothing store, try on your clothes, if they fit well, then you would go ahead and buy them. And so that's where try before you buy comes from. So we have semilunar valves. These are the valves that live between the ventricles and the vessels that leave the heart. And so on the right side of the heart, we have the pulmonary semilunar valve. Pulmonary meaning lungs, blood is going to the lungs from there. And then on the left side, we have the aortic semilunar valve. We have these structures that are kind of string-like. They almost look like spider webs, but they connect from the inside of the ventricles to the bottom portions of the atrioventricular valves, and they're called chordae tendineae. And they anchor those valves so that when they shut, they don't go any further into the atrium. And so if you look at the picture, you can kind of appreciate how that might happen. So every time the ventricles contract, it gives a little bit more strength to the valves so they don't go past the point that they're not supposed to, and keep a good seal. So this is a GIF that's going to show exactly the blood flow of oxygen-rich and oxygen-poor blood. So the atria are filled. Blood moves their way down into the ventricles through the atrioventricular valves and up through those two vessels in the middle, which are the pulmonary trunk, which goes to the pulmonary arteries and the aorta. So if we list this out, we have blood coming in through the inferior and superior vena cava into the right atrium, which passed through the tricuspid valve, into the right ventricle, through the pulmonary semilunar valve, into the pulmonary arteries, then to the lungs where the blood is oxygenated, comes back through pulmonary veins, returning to the heart, the left atrium, then through the mitral valve or the bicuspid valve, into the left ventricle, through the aortic semilunar valve, and then into the aorta where it leaves the heart and goes out to the rest of the body. Promise I'm not a monster. I don't expect you to have written all of that down that fast. Here is a reference slide for you. And that's the end of the lecture. Thank you for joining me.